Welcome back. Still tuned in to Salam Media, and this hour of news and views is sponsored by Africa Muslims Agency. Africa Muslims Agency, a beacon of hope to communities for over 35 years and beyond. And with that said, as I mentioned, we'll be wrapping up this hour of the show. Well, this is the last segment of the show, rather, with the focus to a story happening here on the continent in Nigeria, in particular, where we'll be speaking about, I think, heartbreaking, devastating news about the devastation in Maiduguri, a region in Nigeria where floods have displaced over 400,000 people and claimed at least 24 lives in a humanitarian crisis. And we'll be speaking to Doctors Without Borders director Karsten Noko, who's going to provide us with a deeper insights and understanding of the realities and the difficulties faced by those affected by these floods. Karsten, thank you so much for joining us. Welcome to Salam Media. Appreciate you giving us your time.
Thank you. Good morning, and good morning to your listeners. Thank you for having us.
Pleasure's all ours. I think first and foremost, start by painting a picture for us. What is the current situation in these flooded areas, and what are some of the key challenges that are people faced with?
Thank you. So the flooding that was a result of a dam that was not able to contain a large amount of water and then went into the city. The immediate impact was that a lot of people lost their property, their homes, their food, their belongings, basically. And people had to find shelter. Many of them found shelter in the different schools that were turned into camps for internally displaced people. And then many other people also were hosted by their friends, their colleagues, their relatives. And this is coming at the back of already a very difficult situation for the people that are living in Maiduguri, like in many other parts of Nigeria, where food insecurity has been extremely high. And so our teams, our hospitals have been seeing a large number of patients that are as a result of all of these challenges that come particularly as well now at the time when it's the rainy season here, and malaria is a very high morbidity amongst the community.
I think maybe we can focus a bit on that, the fears that, there might be a spread of these waterborne diseases, and how, it further exacerbates and complicates the situation, and how you guys are able to deal with it.
Indeed. So we, as a medical organization, we run medical activities in Maiduguri for the last couple of years now. And we know that at this time of the year, there are diseases that are related to the, to the environment. So because it's the rainy season, you have an uptick in particular diseases. And in some time of the year, you have an upsurge in other types of diseases. And normally what flooding does is that it has a direct impact on malaria, for example, because all of a sudden you have puddles of water all over the place, and they provide a breeding ground for mosquitoes. And so since the flooding, whenever we conduct clinics, the positivity rate for malaria is about 70%. Of all of the people, and normally we are seeing about 200 people in one clinic, and we have at least 3 or 4 different clinics on each day. So you can imagine just the number of people that are affected by malaria, and particularly for young children, the impact of malaria is quite severe, and many of them tend to need intensive care units for quite some time for their bodies to be able to fight back. We are also quite concerned about acute watery diarrhea or cholera, because Many of the water sources have been impacted by the flooding. The water that was, in a sense, safer to drink a couple of weeks ago, just before the flooding, today may be contaminated. And at a time that traditionally we have outbreaks of cholera in the city of Maiduguri, we are quite concerned that if there's a cholera outbreak right now, as we are already starting to see a lot of patients coming to us with acute watery diarrhea, that is normally an early indication of cholera that is to come.
Can you give us a bit more insights on the response of the local authorities and how you guys interacting with them? Has the response been adequate, and are they allowing you guys to be able to do your work to the best of your abilities?
So we are working in Maiduguri. We have been working in Maiduguri for some years now, as I mentioned. So we are still able to do the bulk of our work. The needs are quite high, I have to state. So what we are able to do is basically very small compared to the actual needs. A couple of days ago, the authorities, in a bid to try to reopen schools, ordered the closure of many camps or schools that people had found shelter in. And so when this happened, people have now dispersed into different communities. And so in these camps, people were getting access to water, because a lot of NGOs had come in, including Doctors Without Borders, made sure that we were providing water to drink and all of these things, because it's easier when people are concentrated in a place. But now with the closures, what it means is that people are now much more integrated into the city. Maiduguri itself is a city that today has around about 2 million people. So it's a very big city, and also quite widespread. So to then now to try to find to respond to the needs now becomes more complicated. But as I say, the real issue is that the scale of the needs vis-a-vis what we are able to do is quite inadequate, so to speak. Yeah.
If maybe you can expand a bit on that, because you've mentioned it twice now, the fact that what you guys are able to do versus the needs, it's currently outweighed. What would you say are some of the shortfalls that you have when it comes to adequately meeting the needs of the area, and to fully assist those that are affected?
Yeah. So for us as a medical organization, what we are worried about the most, of course, is the spread of disease. So for us to be able to prevent a big cholera outbreak, for example, we need to ensure that there is enough sufficient potable water for people to drink. Because if you do not provide potable water, people are going to go to sources that are potentially contaminated. So if enough was being done, it means that for the city of Maiduguri and its people, water has to be provided. But again, as you mentioned, over 400,000 people displaced. It's a lot. And to provide water just for day-to-day use for everyone is already quite a difficult thing to do. And then if you were to go further, for example, into malaria, for us to be able to prevent a big outbreak, it means that we have to be distributing mosquito nets. We have to be doing all sorts of prevention activities to ensure that we don't have a big outbreak of malaria that becomes beyond our control. So it feels for us that we are at the bottom end of the stream, and we are just trying to provide life-saving activities. But if enough was being done, actually, it would be much more upstream to prevent these kind of things from happening in the next couple of weeks.
And you mentioned that if enough was being done, let's expand a bit on that. What more can be done, to try and address the plight of those affected by these floods?
So Doctors Without Borders has been present in Maiduguri for, as I said, almost a decade now, working in the city. The situation has already been difficult for people. So we are, as I was saying, almost at the tail end of the peak season for malnutrition. The number of children that we were receiving in our health facilities who were arriving malnourished and very, very sick was unprecedented. It's the highest that we have seen since we started working in Maiduguri for this activity. So you start to understand that because all of these things, the people of Maiduguri, the availability of drinking water, malaria, all of these things have traditionally been a problem. So whatever was available today is quite strained because of this sudden flooding that comes, and in a situation that has already is quite precarious, and then you have an additional element that makes it even more difficult. Because it was already difficult for us to respond to the malnutrition. And now we were expecting that the number of patients were going down, as they were actually steadily before the flooding came. But now when the flooding came, whatever food that people were starting to harvest from their farms, whatever food stores that some people had, all of that then is suddenly destroyed in a couple of hours. So whatever crops, whatever chickens, goats, cattle, whatever, suddenly is not available anymore. So, and we are starting to see actually in our nutrition hospital that the number of cases are starting to go up again. So it just paints the picture of, the flooding comes as an additional element in what is already quite a precarious situation for the people.
All right, definitely. Karsten, we're going to leave it here for now. Unfortunately, we have run out of time. For those that would like to get involved, how can they contact you guys? Where's your information, website, contact details?
So you can visit the website www.doctorswithoutborders.org.za in South Africa, and you are able to see how you can support MSF through financial donations and through other types of support that you can give.
All right. Thank you so much, Karsten. Really appreciate it. We're going to leave it there for now, and commend you guys for the brilliant work that you're doing.
Thank you, and thank you for the support.
There we go. And as I mentioned, we have come to the back end of our show. That was Karsten Noko, was giving us, the latest coming out of Nigeria. I think devastating stuff there. Nigerian floods displacing over 400,000 people and claiming at least 24 lives in what has become a humanitarian crisis. And the floods themselves not only being the worry, but the aftermath thereof. The fact that, they're in a rainy season in Nigeria and you still have a prevalence of waterborne diseases like cholera and also malaria. And really concerning stuff. And if you'd like to contribute again, as you heard from Karsten there, you can go onto their website, www.doctorswithoutborders.org.za, get as much information as you can. And if you can, also lend a helping hand. It has been another insightful edition of News and Views. Thank you so much for staying with us for the past 2 hours. Thank you so much to my team, Mira of Putin, Sreen, Kolani, and everyone involved in making sure that this is possible and we're able to bring you the latest from all across the world, Lebanon, Nigeria, and right here in South Africa, and giving you the humanitarian aspect of the news, not only telling you the breaking news, but giving you insight on what you can do about it. So really, really interesting show. But keep tuned in onto Salam Media. We'll be giving you the latest updates, particularly coming out of Gaza and Lebanon. People there right now experiencing a siege, a humanitarian crisis induced by the Israeli occupying forces. And we'll be giving the latest coming out of there. If you've missed any of our shows, you can go to our website, www.salammedia.com, and you can read really interesting articles, curated by our brilliant online team, and also listen to some of the podcasts of the previous show that we've had. I think it was a brilliant show that maybe you can check out. Was with Inayat Wadi. He had a really brilliant roundtable discussion on the current state of Lebanon and the impunity that the rogue criminal state of Israel has been operating in. So if you missed that conversation Wednesday night with Inayat, you can go onto our YouTube and various social media pages and take a listen. It was really insightful. But for myself, Salilo Makwidir, and the rest of the News and Views team is goodbye for now. We'll be with you again next week, Wednesday, if there aren't any changes. Tomorrow, Inayat Wadi gives you the Juma edition of News and Views. Goodbye for now.